This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And thanks so much for joining us this morning for Columbus Concerns. As we have been doing the past few weeks, we're going to focus on the coronavirus outbreak here in Ohio, around the country, and around the world. Here in the Buckeye State, the head of the Ohio Department of Health, Dr. Amy Acton, has unveiled a 5-part plan to get Ohio through the next 18 months. Now, during her COVID-19 briefing this week, Acton said it's her goal to not just flatten the curve, but to stay ahead of it.
So it's social distancing, contact tracing, testing, isolation and quarantine, and treatment.
And Acton reminded everyone to continue to wear masks in public and to try to limit trips to the grocery store or pharmacy to just once a week. People around the world are staying home to help curb the spread of the coronavirus, and researchers say it's having a positive impact on the Earth. More from Tanya J. Powers.
Many of us across the globe may be breathing easier these days. Nitrogen dioxide pollution is down 30% in the Northeast, and NASA says the air from Boston to Washington, D.C. is the cleanest it's been since 2005. In Rome, air pollution is down almost 50% from a year ago, and stars are more visible at night. It's most notable in China as well as India, where less smog has given some people 100-mile-away views of the snow-capped Himalayas, something they haven't seen in decades. Animals are also showing up in places they aren't usually seen. Coyotes have been spotted in downtown Chicago, as well as near San Francisco's Golden Gate Bridge. In New York, Tanya J. Powers, Fox News.
And as the nation ramps up to get businesses going again after the pandemic, Dr. Deborah Bricks tells us that things still won't be back to normal. She's on the president's coronavirus task force.
We're going to continue that surveillance from now all the way through the fall to be able to give us that early warning signal. I think what we've learned is how good Americans are about immediately reverting to all of those issues that they need to do in order to ensure that they're protected and their families.
And this week, Governor DeWine said that schools would not be in session in Ohio again this school year. But what's school going to look like in the fall? DeWine says he's just not sure yet.
The possibility of having a blended system this fall. A blended system that might mean some distance learning as well as some in-person.
And officials are warning of a possible second wave this fall when the flu season hits again. More from Todd Pyro.
CDC Director Robert Redfield warning the nation to be cautious, even as some states attempt to reopen their economies, emphasizing the enormous impact of social distancing and the importance of getting a flu shot this summer so that when winter comes, hospitals are not overburdened. But the dire warning grabbing all the headlines is this quote: "There's a possibility that the assault of the virus on our nation next winter will actually be even more difficult than the one we just went through." And when I've said this to others, they kind of put their head back. They don't understand what I mean. Redfield going on to label anti-lockdown protests such as those in Missouri and in North Carolina as, quote, not helpful.
Kroger is offering help to other businesses across the country as the nation starts to reopen. Kroger CEO Rodney McMullen was on Good Morning America this week to share some of the tips and advice they have in utilizing their business and staying open during the pandemic.
One of the things that early on that they helped us with is our associate safety and customer safety. So the things that we put in place in our stores for social distancing, plexiglass protection for our cashiers and our pharmacists.
And he says the grocery stores, warehouses, plants have all been open throughout the coronavirus outbreak, and they can be a blueprint to anyone online. And McMullen says he's keeping a close eye on how things are beginning to reopen in other countries.
What they're telling us now is the recovery is, especially in China, is slow back to restaurants, but people are still coming to grocery stores much stronger than where they were before, and we would expect a similar pattern.
Well, with so much focus on the coronavirus pandemic, it might be easy to forget about other health concerns. Dr. Dan Allen with the Cleveland Clinic says,
there's a lot of problems that don't disappear just because we have a new threat.
And Allen says it's important to stay in touch with your family doctor.
A lot of things we can do virtually or through the telephone, whether it be high blood pressure, diabetes, various lab, monitoring situations, talking about lifestyle, adjusting medications.
And a statement from the American College of Cardiology recently urged people to call 911 if they think they're having a heart attack or stroke. Now, the guidance was issued after a study showed fewer people are seeking emergency room care since the rise of COVID-19. Officials say to call your doctor if you have a medical problem so they can figure out the next step. Well, for the first time this week, the FDA is approving an at-home coronavirus test. Now, the agency authorized testing giant LabCorp to roll out the initial test kits that will allow people to collect samples from home. Commissioner of Food and Drugs, Dr. Stephen Hahn, was on Fox and Friends.
What this does is it allows for home self-collection under certain conditions. LabCorp is the company that developed this. The data show us that the test is accurate and that this can be safely done at home. What happens is LabCorp is going to focus first on first-line healthcare workers and first responders, and then expand it to others. This test can be done two ways currently. We've authorized 4 applications. We have over 170 in the pipeline from developers who are looking at these tests. And what they can do is you can either take a blood test and run it on a machine in a laboratory, or you can do a finger stick. The conditions like humidity, temperature, and the way that the finger stick is performed really affect the accuracy of the test. So at-home testing will take us some time to make sure that those tests are still valid and accurate when they're done in that setting.
Commissioner of the FDA, Dr. Stephen Hahn. Well, it appears the first coronavirus death occurred way earlier in the U.S. than first thought. More from Jack Callahan in California.
The medical examiner in Santa Clara County, California, says new tests show the first death in the U.S. from the coronavirus was not in the first week of March in Washington state, as has been widely believed, but a month earlier in Northern California. Samples from an autopsy done on a person who died February 6th were sent to the Centers for Disease Control, which then confirmed the presence of the coronavirus. 2 other cases also proving to be earlier than what were thought to be the first deaths. The medical examiner says she expects to find others. Jack Callahan, Fox News.
Well, of course, for some people, patience is running out with the stay-at-home orders. But overall, Americans are all for staying at home and flattening the curve.
Despite the major inconvenience, the economic impact, and protests in some states, 72% of Americans want shelter-in-place orders to continue until doctors and public health officials say it's safe. An online Reuters poll released Tuesday shows support for social distancing across the political spectrum. However, 45% of Republicans want restrictions lifted to restart the economy. President Trump says it's time to make America work again, and some governors are preparing to gradually reopen their states. But medical experts warn acting too quickly could spark a new wave of coronavirus infections. Steve Rappaport, Fox News.
Well, one of the nation's largest businesses has a way to say thank you to first responders. More from correspondent Hillary Barsky.
McDonald's is introducing free thank you meals starting today until May the 5th. Healthcare workers, police officers, firefighters, and paramedics can get a free meal at participating restaurants nationwide, available at the drive-thru or for carryout. The meals are available for breakfast, lunch, and dinner and will be served in a Happy Meal box. The 2-week promotion was inspired by franchises that have started similar programs. Millions of free meals are expected to be given away. Hillary Barsky, Fox News.
And stay with us. More to come this morning on Columbus Concerns.
Has your child swallowed your medicine, your laundry detergent, your nail polish remover? Call the Poison Helpline. Have you inhaled paint thinner, glue, pesticides? Call the Poison Helpline. Have a question about a dose, a fume, something your kid just drank? Call the Poison Helpline. Poisonings can happen at the home, on the job, or in the great outdoors. Call the Poison Helpline first for fast, free advice from medical professionals. Call 1-800-222-1222 anytime, anywhere. 1-800-222-1222. Save the number, save a life. Brought to you by the U.S. Department of Health and Human Services.
Also this morning on Columbus Concerns, an update from Governor DeWine on what he calls contact testing. He says widespread testing across Ohio will allow us to reopen the state safely. He and the Ohio Health Department's Dr. Mark Hurst explained contact testing on Friday.
Public-private partnerships like this represent how, here in Ohio, we are, in fact, all in this together. And we believe that these efforts will not only increase our capacity to test by the end of May, but they will provide us with a stable supply chain. So let me outline what the goal is, what we believe this new partnership and the swabs will end up allowing us to do. Beginning this coming Wednesday, our capacity will be at least 7,200 tests per day. That number will grow in a week. Beyond that, May 6th to 1,500 per day. By May 13th, it will be 18,800 per day, and by May 27th, 22,000 per day. As you can tell, this will dramatically increase our ability to test, particularly in the priority areas. And let me talk about those priority areas. We will have a greater ability to go into more nursing homes, do sampling in those nursing homes. One of the concerns that we all have is any congregate care living facility, and nursing homes are certainly an area that we have a great deal of concern. So we're going to be able to get much more aggressive in regard to protecting people in our nursing homes. Second, this capacity will give us a much better opportunity to deal with hotspots wherever they occur, where we have a breakout. We will be able to move in and do the appropriate testing and the other things that we need to do. We'll also be able to focus on other congregate care living settings, homeless shelters, treatment centers, developmental disability homes. Next, we'll be better able to make sure food and grocery workers and employees in essential manufacturing in Ohio are healthy and not spreading the disease. As you can tell, many, many things that we're going to be able to do with this. And finally, what I want to talk about next is the additional thing that's going to allow us to do, and that is to allow us to stand up a very robust, very aggressive contact exposure tracing system in the state of Ohio. And so I want to talk for a moment about this. And I've asked our Department of Health Medical Director, Dr. Mark Hurst, to join us on Skype today to help explain to the people of Ohio exactly how this tracing system works, how we can trace the virus, and why it is so important in helping us go after and attack the virus. Frankly, what I like about this and why I'm so excited is the virus. The virus will stay, but when we separate people and when we're able to make sure that someone who has it does not spread it to others, that is a wonderful, wonderful thing. Before we talk to Dr. Hurst, I want to again thank all Ohioans. Thank you for what you have done. You've been absolutely amazing. You have achieved a great deal, and it's because of what you have done and not done the last few weeks. You have gotten us to where we are today. You have done this the Ohio way. We've done it together. Ohioans are fighters. We now have the ability to really go on the offensive against this enemy. That means we're going to track it down. We're going to isolate it, and we're going to go after it. And the way we kill it is making sure it does not spread to another person. So when that person is in a situation where they're not spreading it, that's a great, great victory. We're going to isolate it, kill it, because if it doesn't have anyone to come into contact with, it simply cannot spread. This is an aggressive strategy, but I think it fits Ohio, and I think it fits our attitude of how we deal with problems. Contact exposure tracing is one of the strongest weapons we can employ to help our families, our friends, and ourselves stay healthy. This is going to all be done in a voluntary way, where we can take some control over this disease. By stopping the spread, We are protecting others. We are protecting ourselves. Contact tracing is one tool. It works along with our other efforts. Does not replace anything, but it's another thing, another tool in our toolkit to go along with the social distancing, to go along with washing our hands, to go along with, in public, wearing a mask. These are all things that are very important. And today we have an additional tool. I'm going to also mention that we are partnering with Partners in Health, and I mentioned them several days ago. A group based in Massachusetts, started by someone I've known for a long time, and that's Paul Farmer. Friend, I've known Dr. Farmer for many years from his work in Haiti on the AIDS problem and on other medical problems. Partners in Health is a world-renowned organization that works to protect communities, and we will bring them in to Ohio to help us on the tracing program. I'm going to now ask Dr. Hurst to help us explain this. And Doctor, what I'm going to do. How you doing? Good to see you.
I'm doing fine. Thank you, Governor.
Good to see you. You have a pretty lively mask there, I see. Pretty colorful.
Absolutely. We should all be wearing them in public.
That's good. Very, very good. Well, I'm going to, Doctor, you will not be able to see me, but I'm going to kind of describe what I'm doing. And I'm doing this for our viewers. And first of all, I hope everyone excuses my penmanship. It's not very good. I was told that many different years in school. It has not gotten any better, as anybody who's gotten a note from me or a letter from me knows. But I'm going to give it a shot here. So, Doctor, let's assume we've got okay, we're going to call, we got a guy by the name of Bill. And I placed him in the center of the board here. And let's say Bill has symptoms, and then he is found to be positive. Let's put a big positive here. You want to walk us through starting with when Bill has symptoms, maybe what Bill should do, and then we'll get into how the tracing system actually works. So let's say Bill's got, he's come down with symptoms, he's very suspicious. What's he do then, and what's the next step for Bill?
So if Bill develops symptoms, for instance, he notes that he has a fever or shortness of breath or a cough, then the first thing he should do is contact his healthcare provider and then ask his healthcare provider what he needs to do. And the healthcare provider may then say, it sounds like you need some testing. You may have COVID-19. At that point, Bill should really try to isolate. If he has to have testing, he should wear a mask when he leaves his house so as not to spread the disease that he has to anybody else. And he should do all the things that you mentioned earlier in terms of washing his hands and the usual infection control things. And then he would go have the test, which would have results back fairly promptly, the way things are going currently, within a couple of days generally. But he should really start to isolate at the point where his doctor says you may have COVID. And that means that he should really be away from everybody else. He should be isolated in his house. He shouldn't have contact with his family or friends. Ideally, he would have his own bathroom, so he'd really be separated from everybody else at that point. And then he would need to isolate until it was safe for him to not do so, which would mean that he didn't have symptoms, that it had been at least 7 days since he developed symptoms, and he had not had a fever and had improvement in respiratory symptoms for at least 72 hours.
And that's Governor DeWine and Dr. Mark Hurst from the Health Department talking about what they call contact testing, which will occur here in Ohio to try to reopen the state.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.